Neil. Good afternoon, everybody, and welcome to the July meeting of Leeds Council Executive Board. Before we get on to agenda, I've just got a couple of people to welcome. First of all, welcome Councillor Alan Lamb as a non-voting substitute for Councillor Andrew Carter. And also to welcome the group of politics students from Dortmund, who I understand are visiting the Civic Hall today as part of a delegation with the Lord Mayor. So you're very welcome to today's meeting. I will now turn to the agenda items, and item 1, please.
Thank you, Chair. To confirm, there have been no appeals received for today's meeting. Exempt information. To confirm, Chair, there's no information within the agenda designated as being exempt from publication or confidential.
Thank you. And we're on to item 3, late items.
Thanks, Chair. With your agreement, a report has been added to the agenda and provided to board members entitled Children and Family Social Care Workforce in Leeds, to be considered as part of the Adults and Children's Social Care and Health Partnerships portfolio.
Thank you, Gerard. And we'll take that as item 20 in terms of the agenda running order. Item 4, declarations of interest, and I'm turning to the board for this. Councillor Pryor, please.
I've an interest in item 6, so I'll be leaving the room for that item.
Thank you. We'll move on to, as I can't see anybody else indicating, we'll move on to item 5, which is the minutes of the June meeting, and check that the board is happy that they are that they are a correct minute. That's great. Everybody seems happy with that. So, as item 6, as Councillor Pryor indicated, he will be leaving the room for this item. So that means I will ask in terms of the Refreshing Leeds Cultural Investment Programme, I'll ask Eve to introduce this report, please.
Good afternoon. My name's Eve Roothouse. I'm Chief Officer for Culture and Economy. In terms of the report you see in front of you, it relates to our cultural investment programme for the council. In 2021, we came to the exec board to get agreement to extend our Arts at Leeds funding programme for a 5th year to help stabilise the Leeds creative sector through the COVID-19 pandemic. And we're now requesting that we approve, that the exec board approve a 1-year cultural grants programme for financial year 23-24, in order that we can do a full refresh of our cultural investment programmes for the following 3 years after that. That refresh will allow us to ensure that we adopt best practice, that we can maximise the benefits of the funding to the city, we can align to opportunities around the UK Shared Prosperity Fund, and also bake in legacy around Leeds 2023. The 1-year approach also means that we can align money around what will be going on through in the city through our year of culture next year. The 1-year programme will operate within the existing budget envelope, and organisations will be required to apply for grants. That's the main difference between last year's request and this. So last year it was an extension of existing grants. This year it will be that organisations will be required to apply for those grants, but we will allow an extensive application window which will run through the autumn, and organisations applying will have each access to a grant surgery to be able to be supported through that process. Thank you.
Thank you, Eve. Are there any comments on the paper? Councillor Galton, please.
Thanks, Chair. I really appreciate the clarity here in terms of a short-term and a longer-term plan for the future. But it is very much focused on the distribution of cash. And one of the things that I think a lot of us that were excited about Leeds 2023 were interested in was how arts organisations across the city could find themselves, perhaps during that period of celebration and support of the arts, in a better sustainable position as organisations. And that doesn't mean being able to access cash. Sometimes it's about actually making sure that their organisational structures are fit for purpose. And that is often delivered through mentoring rather than writing a check. So I'm just wondering, is there anything involved in this support package which encourages the take-up of such guidance rather than, you know, applying for £500 here and £1,000 there for specific timed activity?
Eve, please.
So in terms of how we support organisations that get access to grants, both through Arts at Leeds and Leeds Inspired, our staff do provide considerable support in the process and advice. So, for example, Leeds Inspired Small Grant Scheme just celebrated its 10th birthday. And during that 10 years, it's helped organisations where individuals have applied for grants for events and activities that have over time become much larger. So the Transform Festival is a really good example of that, run by Amy Letman in the city. And they have become sustainable in terms of being able to access money from other sources. I think there will be an opportunity through UK Shared Prosperity Fund to make sure that arts organisations are also tapping into other support that might be available, more typically accessed by businesses. So we'll make sure that we look at that when we're working that through as well.
Thank you. Are there any more comments on this paper? Councillor Lamb, please.
Yeah, thank you, Chair. Just a couple of quick points and questions. First of all, just it's slightly straying into Leeds 2023, but with all the workshops and road shows that have been going on, there's been suggestions, and I can't remember the terminology, of some sort of local champions that would be there for legacy and so on. It's just an assurance that we're going to make sure that's a supportive thing. We're not going to be sort of treading on toes of successful local organisations that are already doing well. And so we're not treading on people's toes. And then I just wonder if you could confirm where we're at with funding on 2023. So my understanding, roughly speaking, there's about £14 million of public money, mostly from the council, some from grants. So I'd be grateful if you confirm how much we've got from private sponsorship, and what's the single largest donation or piece of sponsorship that's been received, and an assurance that that's the limit on what the council will be contributing, that we're confident that everything's covered from here on in. Thank you.
Thank you, Eve, please.
Thanks, Councillor Lamb. So I think you're referring to the neighbourhood host roles. So just for the benefit of everybody, if anyone wasn't aware, Leeds 2023 have a programme that is fully funded through the Paul Hamlin Foundation called My Leeds 2023. And My Leeds 2023 is about working in every ward across the city towards something called the Big Weekender. You can recommend individuals to apply to become a neighbourhood host now. The application process is still open. The neighbourhood host will have a key role in working with those local organisations to make sure that what is delivered using the money that is available is complementary and enhancing what is happening in local areas. That individual will be heavily invested in by Leeds 2023 to upskill them and leave skills with them that can then be embedded into the community. So it's really important that each ward gets a really strong application for that process, so we get really good candidates. But all of that is, just to be clear, that is all being managed by Leeds 2023, the Culture Trust, which is separate to the council, not by the council itself. And then your second question about financing, can I suggest I send a note about that, Leader, just to clarify the exact figures? Would that be acceptable? Yeah, so I'll send a note.
Yes, of course. Thanks, Eve. Do I see any more comments on this paper? No, that's great. So I'll turn to the recommendations on page 22, and I take it everybody is happy with those. So we'll move on to the next item. Somebody could retrieve Councillor Pryor, please. Here he is. Could you take us through item 7, please, Councillor Pryor?
Of course. So this report updates Executive Board on the outcome of the recent consultation to permanently increase learning places at Leeds City Academy, and this would take the PAN from 150 to 210. The school has taken bulges of this size twice already, and this would make that expansion permanent. As part of this consultation, 59% supported the proposal. Objections and concerns largely surrounded traffic and highways concerns, which as local members, myself included, shared, but this will be looked into in further detail in the planning stage. It's probably worth noting that this is the first report on school expansions where we've got a range of associated cost. This is largely due to given the inflationary pressures. What we've done is we've adopted the recommendation as recommended in the Treasury Green Book for optimism bias, but happy to go into more detail on that if necessary. It is clear that all of the building work is currently more expensive than it has been over the past few years, given the current state of the economy. Luckily, as a council, we have completed the vast majority of necessary school expansions over the past few years. So while we have been seeing a lot of school expansions come to Exec Board in recent years, this will be slowing down as we have completed most of these while it was cheaper to do so. So Executive Board is asked to approve the expansion, grant approval for authority to spend up to 8.9 million on the scheme, and note that the White Rose Academies Trust intends to self-deliver the scheme. Thank you.
Thank you. Are there any questions or comments on this paper? Councillor Lamb, please.
Thank you, Chair. It's just a quick comment, just to obviously knowing the history of the school, to see that it's doing so well, and for a school that's had a troubled past, it's to congratulate the school leadership that they're actually popular and needing to do this, and it's really good to see.
Is great news. If there's no more comments, I'll turn to the recommendations on page 54, and I take it the board is happy with those recommendations. So we'll turn to item 8, please, in Councillor Arif's portfolio.
Thank you, Chair. So this report focuses on our approach to COVID-19 following the government reducing access to free testing and requirements to self-isolate earlier this year. Whilst COVID hasn't gone away, we are in a very different position now compared to the start of the pandemic. The vaccination programme has been successful in decoupling the impact of COVID-19 on hospitalisations and deaths, and more treatments are now available. The strategy encourages individuals to adopt safer behaviours in common with long-standing ways of managing other infectious respiratory illnesses such as flu or the common cold. It's also really important to know that systems are in place to scale up to deal with future variants of concern, surges in cases and hospitalisations, or if the vaccine becomes less effective. We will work closely with the UK Health Security Agency locally and nationally to monitor the local position and manage outbreaks and any new variants of concern. This includes closely monitoring the local surveillance on the increasing numbers of people in ICU and increasing hospital admissions for COVID, any new variants of concerns that are driving rates and increasing all-age, all-cause mortality. We'll also ensure that the uptake of the COVID vaccination is maximised in all communities and across all geographies through the Leaving No One Behind NHS vaccine programme. This work should dovetail with other vaccinations programmes, including the flu and childhood immunisations, providing intensive support and building confidence in those areas and social inclusion groups with low uptake. We'll also make addressing long-term impacts of the pandemic, including the longer-term impact on challenges of mental health and reducing widening health inequalities, a priority. This approach will ensure that we are in a strong position to live with COVID and respond should the national position change and require a different local response. It is recommended that the board approve the proposed approach to the Leeds system going forward, ensuring that people are supported as we move into a living with COVID phase, and that we respond with compassion, kindness as part of the Leeds team ethos. I'd just also like to take this opportunity to inform the board about the planning for winter surveillance, building on partnerships strengthened during the COVID pandemic. The health protection system is working together to ensure that the robust and resilient arrangements are in place to prevent and respond to any infectious disease outbreaks. Thank you, Chair.
Thank you for that introduction, Councillor Arif. Are there any comments on the paper, please? Councillor Lamb, please.
Yeah, thank you, Chair. A couple of comments. I think it's a welcome paper, so thank you for that. the two things that I wanted to mention were, firstly, I think it's really important at this time, with more home working available and changes and things, that we're really, really careful to make sure the council does not become remote from its citizens and from people, and that we remember that we're a public service organisation and we haven't got too many people working away and not being customer facing. And I think that's something that we can do to help and support people. And the second point, and I probably make similar points in the next paper, and you'd be astonished if I didn't bring it up, is the importance of really looking at the impact on young people as part of the pandemic, because whether it's in early years, whether it's transition to high school, whether it's doing exams, more than any other age group, children and young people are not going to get the time back that they've missed through the pandemic, and it's going to take a long time to understand fully what that impact is. And I know we're on it and there's papers about it, but it would be wrong not to bring it up at this point, I think. And I think it's incumbent on all of us to keep that in mind through all decision making and all things we're looking at, that impact will last for a lifetime, and we have to make sure we keep recognising that.
Thank you, Councillor Lamb. I'm going to bring Councillor Cooper in, please.
Thank you, Leader. And I just want to give some reassurance to Executive Board in response to Councillor Lamb's question around remote working and our staff in terms of how we're looking at the agile working going forward. We took a report and a conversation to scrutiny earlier this week to discuss the very issue, and we're working through with scrutiny about bringing forward a paper to Executive Board, but we want to work with scrutiny before we bring that through to Executive Board. But please be reassured that that work is being done thoroughly by the organisation.
And of course, it's always worth remembering that thousands and thousands of our staff have never worked in an office and are quite clearly providing that service out to the public across the city as well. Tom, would you like to come in, please?
Yeah, I just wanted to support the paper and just sort of maybe a good time to pay tribute to Victoria and Dawn, who are here, and the work that they've done to get us to this point. And I think the real strength of our approach has been to build out from the Health Protection Board and the work that goes on already in the city, and not try and do something that's been sort of dislocated from that, but effectively expanded that to the sort of whole city system, including this board regularly. And I think the report that's attached to the annual report that's attached, shows the breadth and range and quality of that work. And I think it's so important that is really at the heart of what we're trying to do to combat inequalities in the city. And I think, having visited some of the teams recently, I can see what a difference that makes to some of our most vulnerable people. So just to really support the that how we take that forward, that work, and make sure that doesn't go off our radar as we move forward and live with COVID, as Councillor Arif has said.
Thank you, Tom. Councillor Arif, please.
Yeah, I'd just like to add to the thank you as an exec member, the support that I received from Victoria and Dawn through some very challenging times, and the leaving no one behind, in communities where we know they were impacted far more from COVID, and then the work we've done in those communities, the innovative work that we've done, and it is picked up in the report about the roving buses, the women-only clinics, but that still doesn't stop. There are still communities where we have not got the uptake that we need, so that work will continue. Councillor Lamb, just picking up, I will pick up on your points in the next report about the young people and mental health, and you're absolutely right, it has impacted, we know that, by over 20%, and that's what the figures are telling us, and that's why we've got the Future in Mind strategy that was approved in April 2021, which is specifically for our young people. And obviously the report that I will come on to next goes in more detail about that. But absolutely right, that the impact for young people post-COVID is definitely distressing, and it's something that we are dealing with.
Thank you. And Victoria, would you like to come in, please?
Yeah, thank you, Chair. Just a quick comment in relation to Councillor Lamb's second point. we're really pleased to get to this chapter of the pandemic when we can talk about living with COVID, even though it brings its own challenges. But in terms of your point about balancing the risks, including to children and young people, we were always very, very mindful that we need to, as a city, take an approach that balances the risks to people individually from the virus and infection with the wider risks to their health and well-being from the measures we take to control the virus. And we were always incredibly focused on trying to get that risk right. So whether it's about visiting people in care homes, whether it's about people who've previously been invited to Shield, or the impact on our children and young people, just to provide that assurance that it is a central principle around how we learn to balance people's broader health and well-being, as well as that risk of infection. So I hope that comes across as central to the approach, and it's definitely something we're very mindful to make sure we've got that balance right. Thank you for raising.
Thank you, Victoria. I'm going to turn to the recommendations on this report on page 75. And I see the board are happy with these recommendations. So Councillor Arif has already trailed it, but we'll move on to item 9, please.
Thank you, Chair. So I'm pleased to introduce this paper that details the great work across the city to address mental health. Leeds has a long history of championing good mental health through the delivery of preventative programmes and diverse mental health services. The whole system approach is more vital than ever due to the mental health impact of COVID-19, compounded by their cost of living crisis. I hope it wasn't anything I said. We know from national research that there will be an increase in common mental health conditions, likely anxiety and depression in adults, and increases in the number of people experiencing grief and trauma. Locally, we can see that the number of adults seeking help for anxiety and depression is now 20% higher than it was before the pandemic, and this is just literally the tip of the iceberg. For children and young people, the COVID-19 pandemic has intensified risk factors for mental health issues. National evidence suggests that those at greatest risk of poor mental health during the pandemic include children with previous mental health issues or with learning difficulties, and those living in areas of greater socioeconomic disadvantage. The All Age Leeds mental health strategy sets out how we are working together across the sectors to ensure that Leeds will be a mentally healthy city for everyone. This was approved by the Leeds Health Wellbeing Board in January 2020, but due to the pandemic, it wasn't launched. Some parts have been updated since then, and we will be looking to relaunch on the 10th of October 2022, which is also World Mental Health Day. In April 2021, as I've said, Councillor Lamb, the Health and Wellbeing Board also approved the Future in Mind. This is our specific mental health strategy that leads action on the mental health for our young people. I'd like for the board to take note of the extensive work that has been delivered and around mental health, and acknowledge that for Leeds to achieve our vision of being a mentally healthy city for everyone, we need to tackle the factors that increase the risk of poor mental health head on, and invest in things that we know promote good mental health. This includes having strong services and support in place, but perhaps more importantly, it does include ensuring that people have access to safe, green spaces, addressing racism and discrimination, and supporting the creation of sustainable jobs. We all have a role to play in improving the wider determinants of mental health. Thank you.
Thank you, Ella. Any comments on this paper, please? Councillor Lamb, please.
It's just a quick question. I've made my comments on the previous one. How will the relaunch of the strategy be advertised?
Yes, Councillor. My name is Karen Walker. Just to answer your question, it's very much been led by our colleagues in health partnerships who are leading on that. So it'll be advertised right across the city as well. There'll be our programme events both for World Suicide Prevention Day and also World Mental Health Day, and it'll tie in with that.
Thank you, Karen. Tom, please.
Yeah, just to add to to what Karen said and the great work that she's leading for us, and with Councillor Arif, and I have the mental health champion role at officer level, so I just wanted to support the paper and just mention our role in promoting the work that's been done. You know, I think particularly an issue that I think is particularly important for us to try and work together with the business community, with other partners in the city, is the sort of self-support networks that we can encourage in the city. There are lots and lots of families going through, you know, really challenging times where one of their, you know, younger family members is having difficulty with their mental health, and there's just, you know, not the support systems in place to deal with the demand after the pandemic in the NHS, particularly for, you know, for that sort of activity. And I think the more we can give people safe spaces where they can share experiences, where young people can see that, you know, there are other people going through similar challenges, other people who've got through those challenges as well, but also the parents who you know have to still come to work. They still have to, you know, live their lives, do all of that at the same time as dealing with you know, that sort of crisis within their own family. And I just wanted to mention that as something that I think is really important to try and tap into that wider, you know, support support that we can get from the partners in the city for that cohort of people, and make sure that we're picking that up, because it does become the most important thing in families for a period of time, but it is possible to get through it. And I just want to make sure that we follow that up in our promotion role moving forward.
Thank you, Tom. Somebody else want to come in on this report, or I will take it not? Councillor Arif? Okay. I will turn to the recommendations on page 119. I take it the board are happy with those recommendations. So thanks, Councillor Arif, and we'll move on to Councillor Hayden's papers and item 10, please.
Thank you, Leader. So I'm really pleased to present this paper, which sets out the council's plans for adapting to climate change and making Leeds a resilient city. I mean, as we all saw last week, the effects of climate change are already happening. It's not something that's going to happen in the future. We've never had temperatures of 40 degrees in this country, and it is, and the other scientific consensus is that it is a result of human climate change. So this report sets out how Leeds is adapting and plans to adapt to the effects of climate change to ensure that the city is as resilient as possible. And those four main areas are heat, which we experienced last week, flooding, which we unfortunately have experienced in recent years, drought, which the news this morning is that the last 6 months have been the driest since 1976 in this country, although people might not have thought it this week, and cascading impacts such as trade disruptions and population displacement. So it is in line with the council's third pillar in addressing climate change. It is in line with the National Adaptation Programme, and it sits alongside and it complements our ambition to be net zero economy. We've set a time of 2030. However, we need to do it as quickly as possible to mitigate some of those effects that we're already experiencing. So it is very important that we adapt and that we have that resilience, because the effects are already with us, but it's also equally important that we lower the carbon output so that those effects are not made even worse or more frequent. Can I thank Polly Cook, Jonathan Moxon, who is our flooding czar, and Harriet Spate and Chad Newton for this report and all their work keeping us safe and achieving net zero. And I'm I invite Polly to talk to Exec Board on this report if she wishes to do so.
Thank you. Polly would like to come in, please.
Thanks, Councillor Hayden. I think this is a really important step forward. We have, as a city, we've really focused on flooding, but I think what this does is make sure that we're looking at all possible impacts of climate change. And I think we're planning to run this series of workshops and make sure as a council we're really prepared, but we're also really keen to invite others across the city to join into those workshops. We've already offered that invite out to the anchor institutes, and we'll also work with some of our private partners to just make sure as a city we are on the front foot and looking to also be a role model for what happens across the rest of Yorkshire and Humber. So just trying to move as quickly as we can, but like Councillor Hayden said, not losing a focus on actually reducing our emissions at the same time, but we need to work on both in parallel.
Thank you, Polly. Are there any comments on this paper? Councillor Lamb, please.
Thank you, Chair. Just a couple, lots of good things in the paper. Two bits of feedback I've had from our members on SEAC are one, that there's been a change of chair has brought a welcome change of tone and focus to those meetings, which is a positive thing. What they've also fed back is it would be very helpful, appreciated, and help to move things forward if the executive members attended those meetings to be held accountable and were present at them. So that's the feedback we've been had. So I hope that's perhaps something that can be taken on board.
Thank you. Councillor Hayden, please.
Thank you. Yes, I attempt to get to every one of them, including the working groups as well. So, and as does my deputy, and is it about other? If it just be fed back to me, maybe outside this meeting, if it means other exec members, because I generally, unless there's something else comes up, attend every meeting. So if it just could be fed back, if that refers to other exec members. Thank you.
Thank you, Councillor Hayden. Councillor Galton, please.
Thanks, Chair. Well, I'm sure that the chair of the SEAC, with the support of the shadow chair of the SEAC, can come in with lots of activities that they can share between them in terms of hosting. And we look forward to that programme of developments from that organisation going forward. Getting back to the point, Chair, because we're talking about heat, aren't we, and adaptation associated with climate change. It's a very comprehensive report, and it has lots of links in it to referencing academic papers and whatever, but for the layperson like myself, who isn't an expert in climate change, that it was very hard to focus on anything in it that identified what the city was hoping to focus on at pace in terms of responding to the issues that the paper addresses. So could you give us a guidance as to which parts of the council you think need to respond very quickly? So for instance, I can think of, there's lots of buildings going up in Leeds City Centre that are about 70% glass, which you would think doesn't make a great environment to live or work in if there's a heat wave on outside. And then of course, there's also the issue of food security, and Leeds is actually, in terms of surface area, has more agricultural land in square footage than it does in urban housing or industrial land. And given the needs for future food security, perhaps looking at how we make sure that our rural economy is thriving in the face of environmental onslaught might be another thing that we need to look at very quickly. Can you offer some guidance as to what we would like to do at pace as a city after having adopted this paper?
Thank you. Polly, please.
Okay, so I think what we've committed to over the next 12 months is to do a kind of holistic review of every area and all the things you flagged. I suppose the focus first was internally in terms of the council, and so we already have a good baseline. So things like public health already have a heatwave plan. What we're looking to do is to make sure that it's sufficient, and that with the academic input in terms of what we are anticipating coming forward, you know, we're planning for heat waves as we experience them at the moment, and what we're trying to do is build on that. I think in terms of key areas, planning, we're already starting to have those discussions, making sure that the local plan adjustments are suitable, and that was already on their radar. But also, you know, things like our workforce and some of the adjustments we saw made last week, how we build those in going forward, things like our IT systems, conversations with NHS Digital about things we need to do to make sure we're future-proofed. So it will cut across everything. I don't think there's one specific area that will be more important, but all the things that you flagged will be picked up.
Thank you. Certainly those of us that represent the rural areas have worked with our farmers on some of the issues that have been raised around adopting to a different climate. So does anybody else want to come in? Councillor Hayden, please.
Just on the food security, I actually chaired whilst the change in chair was happening, the food CEAT food subgroup recently, and we have a food strategy to be as low carbon as possible with our but it also includes food security, and the team is already looking with planning and other areas at the land use and as many innovative ways as possible of growing our own food, of buying locally, of that food security. And we're working with the University of Leeds on a carbon calculator for food, and our schools have been very involved in making the school meals with the children as well, as low carbon as possible, including meat-free days, etc. So, and which the children have been very much on board with and included with in that consultation. So, there's some really good work going on with food, and we're quite ahead of the game in terms of our food carbon output and in terms of food security as well. Thank you.
Great, thank you, Councillor Hayden, and good to hear that you're chairing CEAT working groups as well, so members have that direct involvement. Does anybody else want to come in on this paper? I can't see anybody else, so I'll turn to the recommendations on page 139, noting the consultation as well, and see everybody's happy with those recommendations. So thank you, Councillor Hayden. We're on to Councillor Howell's report, item 11, please.
Thank you, Leader. This report sets out the Council's work in responding to the current cost of living crisis. It provides a local context and background of the current crisis and shows how some of our residents were already less resilient to financial crisis prior to COVID-19, the war in Ukraine and current record inflation levels, and also a number of other factors. It shows how the number of Leeds residents claiming universal credit has also risen very steeply since the pandemic. The report sets out how we propose to tackle the various aspects affecting the current crisis, such as food and fuel poverty. We're doing all we can to mitigate the impact of the crisis on our most vulnerable residents, and the report sets out this in detail. Among many other initiatives, we've increased our fuel vouchers. We've continued to provide local welfare support scheme since the end of ring-fenced government funding, and we've topped up our discretionary housing payments fund by £500,000 a year for the past 3 years. In addition to setting out what we're already doing, the report proposes steps to embed tackling poverty and inequality more deeply in our strategic objectives. This will be considered and embedded within each pillar of the Best City ambition, which will underpin everything we do. The Best City ambition will have a new performance reporting framework so we can measure our progress and use the information to direct resources where they're most needed. There will also be a strategic welfare group set up by the financial inclusion team to cover food, fuel, housing and digital poverty and inclusion, as many different council teams and services have a role in tackling this crisis. We will also be involving our partners outside of the council in our work to improve the lives of our most vulnerable residents, and we continue to invest in our third sector partners. Changes in our strategic approach to tackling poverty and inequality will help us sharpen our focus on tackling this crisis and involve everyone who can play a part in improving the lives of our residents who are struggling to access basic necessities. Overall, this is a very positive report showing how and what we've done for a number of years in Leeds and how we continually refresh our approach. Our financial inclusion team are award-winning and are an exemplar nationally. And I'd like to say at this point, thank you to James Rogers, Lee and the team for the continued work in how they look to help our most vulnerable residents and anybody that's struggling in this city. Thank you.
Thank you, Mary. Are there any comments on this paper? Councillor Galton, please.
Thanks, Chair. It's undoubtedly a very big issue, and it's not argued that the council already had quite a significant offer out there for the community. What I found difficult to understand in this paper is what it was that the council was offering anew through this strategic paper. I wasn't sure what you were announcing in terms of things being done a bit differently or a new initiative being started. And I'm looking at point 99 on page 168. There are 3 clear but connected ways forward which we propose we should now be prioritising. But when I read them, I couldn't find any clarity at all about what it was that you were going to do differently. Can you please clarify it for me, Councillor Harland?
I think the paper sets out a great deal that we're already doing differently and how we continually to look to change and adapt how we can help. I don't know if James or Lee would like to come in.
I'll come in first, Chair, and then I'll let Lee just add a bit more detail. I think it's fair to say, as Councillor Harland said, we've focused upon this particular agenda for some time now. So there's lots of work that's in train and been in place for a number of years. And we've also invested more funding in that activity, particularly over the course of the last 12 months, and particularly utilising things like the household support fund. So there's all sorts of new things that we are doing now that we were not doing, for example, 12 years ago, which are summarised in the paper, but we can also provide Councillor Galton with specific detail on that, which are contained in other reports that we produce, for example, on how we are utilising the significant funding that we've got through the Household Support Fund in terms of new initiatives. So there are a range of things that we're on with. Looking forward, when you get to paragraph 99, that's saying, asking ourselves the question, and what more can we do? And what we need to do there is liaise with all of our partners, particularly in the third sector, and work out what other opportunities we've got to provide even more support for people of Leeds. Don't know, Lee, if you want to add anything to that?
Thank you. Just on the welfare, the breakthrough project, the group, I think one of the aims there, so during COVID, it was clear that actually the way we worked on that around sort of food and welfare, we got a lot of learning out of that in terms of how we did it and how we reviewed. So we are doing things like reviewing local welfare support and things like that to look at it more broadly. And this group will hopefully learn from more. So one of the things, it isn't referenced in the report because it's only a learning point that came out, but we know it's something that we hope the breakthrough project will do, is that when we referred during COVID for help and support around direct spots or food, for example, into third sector or the community care hubs that were set up at the time, they were able to support on that direct provision of food. And you'll appreciate that because of your involvement in that. But one of the things that we got feedback from was that they weren't then able to signpost appropriately into the sort of more sustainable support that some people and families needed to enable them not to be so dependent on the food. So one of the things we want to do is create an infrastructure, and that might be a sort of physical and digital infrastructure in the city that enables those agencies. It doesn't matter who they are, it could be the council, it could be third sector, it could be a statutory partner, to refer into the right place and then monitor that process, or be able to make sure that that person's getting the support that they need and things like that. So that's one example of where that the welfare group, the city group, is one of the potential ideas we want to go forward on. I suppose the other point I'd raise about the 3 pillars and the strategic review, from a sort of welfare perspective, there's only so much that we can do, and it's the sharp end. You've almost, you know, that old adage about stopping people falling in the river. The welfare stuff is you're helping them out of the river. So the 3 pillars work for me is about making sure that that's the more sustainable and long-term sort of generational change, if you want, for want of a better word, around poverty and inequality, and it's those strategies. So I think between the sort of strategy change and the welfare group and learning how we can be much more integrated, I think we've got a even better solution going forward than what we've got.
Just a short one, Chair. When does that group report back?
So we're doing, so the way we've done it now, we've got about 18 one-to-one meetings set up over August, covering council services, statutory partners and third sector. So we're doing them. The aim of those meetings is to go and find out what their sort of key issues are, who their partnerships are and who they work with and things like that. We'll pull that together as a baseline. That group will meet first. The aim of that is for that group to meet in September, to come forward with scope and governance, because that's the other issue here. The governance needs to be determined, because I don't think it needs to be more than just one group, if I'm honest. I think it's too big an issue to deal with. So we'd be coming back with that, and the aim is to report back here before Christmas on that work.
Thank you. Councillor Harlan, please.
Just to say, we'd be happy to invite you along as well, Councillor Galton, so you can input directly.
Be careful what you wish for, Councillor Harlan.
Thank you. Councillor Lamb, please.
Thank you, Chair. I'm trying to avoid the risk of rerunning last Wednesday's conversations. So the caveat at the start is to say, from my perspective, others may disagree, the government have done a lot on this already. Can they do more? Yes, I think they can. Should they do more? Yes, I think they should. I think they will. No. I think they will. In the unlikely event that any of the leadership candidates listen to the likes of me, then hopefully they'll take that on board. I hope in this forum, Councillor Harlan will take the opportunity to correct that we're not providing £9 to every person in Leeds, rather £220 to 64,000 people in Leeds. So, yeah, I think the government can and should, and I think they will do more. I think the responses to Councillor Galton's paper and this paper are, we're kind of looking backwards at a lot of the good things that we've done. Really, my question is, what more can we do immediately to help people? I think the government should be doing more, and I'm sure you'll agree with that immediately, particularly with energy prices going up. The crises are going to get worse before it gets better. And what this paper doesn't tell us is what more the council can and will do immediately to help people.
I think, again, reflecting on the debate we had in full council last Wednesday, I was actually struck by something one of your members said, Councillor Lamb, around the cost of living crisis will affect people who haven't had required the welfare system or the support system ever before. And I think the importance of looking back at what we did during COVID comes into that, because of the issues around the requirements for people to isolate at times. During that, again, there were people who were very self-sufficient until something happened that doesn't normally happen, which required them to need our support. And I do think that is where that's one of the key threads through this paper for me, that takes us from COVID and understanding what happened as a result of the public health and government restrictions there, and looks again at a cost of living crisis that may well bring people into requiring support that aren't in the 64,000 that you referred to. And I think that's the important point around reflecting that. I know we probably all had conversations with people in our ward, people who thought they were doing okay until they saw their gas and electricity bills come up, and that's an important point. And I do think that's why it is worth reflecting that this has to cover everybody in the city, and B, we have to be very alert to people who haven't in the situation before in the welfare system we've got ever had to access support that may need to do so, and that's got to be at the centre of a lot of work we are doing on this. So, Councillor Harland, do you want to come in, please?
I'd just like to say, Councillor Galton said, be careful what you wish for. One of my wishes was that one of the opposition would say, hope the government gives us more. Thank you for that.
Great. Are there any more comments on this paper, please? I don't see any comments. I'm going to turn to the recommendations on page 159, noting the invitation for involvement from members of the opposition in this work moving forward. I'm sure that'll be picked up, and I take it everybody is happy with those recommendations. Great. We're on to the papers in my portfolio now. The first one is I always risk saying should be a straightforward paper, but the first one is the review of the protocol of the roles and members and officers in decision making. This reflects the fact that, first of all, the protocol hasn't been updated for a good number of years. Secondly, that it's been picked up through our corporate governance and audit around some areas for changes which this report recommends. And thirdly, any changes that need to be made, any minor changes that need to be made in the future, for example, around changing political or officer roles, can be delegated. It gives it permission for that. So with that, I'd just see if there's any comments from the board on this paper. I don't see any. I turn to the recommendations. I take it everybody's happy with those recommendations. That's great. The next item is item 13. Anybody superstitious might wonder why risk items number 13 on the paper. I do think that the this is an annual report that we bring to executive board every year. I do think it's really good practice for those of us political decision makers to see this report annually and reflect on those corporate risks as well as the ones in individual services. The report sets out what the assessment of the risks are and the steps we've taken. I'll see if there's any comments from the board on this paper. I don't see any comments, so I'm sure everybody's read the report, which I know is a really interesting and useful piece of work. I'll turn to the recommendations on page 186, and I take it everybody is happy of those. Item 14, blimey, my papers are turning into a monologue here, a not particularly interesting one, but a monologue nonetheless, which is the annual corporate performance report, which is our work set against the priorities to set ourselves in the best council plan. I was thinking back when we agreed the best council plan we're talking about. I think it's one of those meetings where we were all doing full council still, sat at home, and I think it shows the pace of change in the year that's gone in terms of coming through COVID and back into the current ways of working. There's a huge amount of information in the report. I don't particularly want to pick anything out at this stage that sets out the thing. What I would say is this report will form the basis towards our corporate peer review in the autumn. So as well as looking at what we do ourselves, I think it's important we do get that external view in on the priorities we set and the outcomes we hope for and how we get there, and to make sure we're getting a robust peer challenge towards those. So I will see if there's any comments on this paper. Councillor Lamb, please.
Just in the interest of breaking your monologue for you, Chair. When can we expect the targets and KPIs to be reviewed so they are smart and we can really measure them and hold everybody to account properly?
Tim, would you like to come in on that one, please?
That's right. Good afternoon. Tim Rollett from the Council's Intelligence and Policy Service. So we've recently introduced the Best City Ambition. And when you introduce a new corporate strategy, it's good practice to review how we measure performance against that strategy. And right now we're in the middle of a piece of work where we're looking at all the performance indicators What do we need to report? Where does it need to go to? The targets obviously need refreshing because the targets we used to have were pre-COVID, whereas now we know that some of those targets are out of date and need to be revised, along with what we call the baseline, which is where the first set of performance information came from, which is useful to look back. So a big piece of work that we're underway with, we're going around all the directorate management teams in August, and also scrutiny board chairs to get their consultation on this, because scrutiny board also look at these performance results. So it's a really good piece of work to refresh what we're reporting, why we report it, and what do we need to compare it to. For example, core city results, benchmarking historic results. So there's a very thorough piece of work going on, and dare I say it, but next year's report might be a little bit longer than this year's. But if you've got any queries or anything you'd like to talk about, quite happy to meet up on that one.
Thank you, Tim. Councillor Galton, please.
Thank you, Chair. It's associated really, because there are different, they're not pillars, are there? They're subject matters, or are they obsessions, or what are they called in the corporate plan? Sorry, like health and well-being, housing, age-friendly.
They're referred to in the Best Council Plan as priorities.
Priorities, right. Okay, just wanted to get the terminology right. Where in the plan do we recognise that some priorities actually can be counterintuitive in some of our decision making? Like you can't actually deliver both. And what is our process for evaluating which comes out on top? And then the second question is, how many of the performance indicators that are in here can be taken down to ward level so that we can see the differentiated performance across a city? So for instance, on the housing measures, it talks about number of affordable homes delivered, but it's on a citywide scale. And as we know, the meaningfulness of such statistics is actually based on whether or not you've got affordable homes in the community that you actually live in, because we're a very big city. So that would be useful.
Tim, please.
Yep. So in terms of the second question, not all the performance indicators will have the information available at ward level, but where the information is available, we can find that out for you. I don't know, Martin, if affordable homes is one that we can get that on. I can find out though.
Well, we have the information, Chair, because we will have collated it, so we'll be able to provide it.
Thanks. And then in terms of the first question about how these sort of priorities or pillars compare against each other, that's a bit of a more tricky one to answer, because they're all important, and they've all got different sets of KPIs, and it's a bit of a challenge to work out which is the most important. But generally, if it's a new key performance indicator that's going to underpin the best city ambition, then it's got a priority, and it's difficult to work out which is more important than the other. We don't apply a weighting to it.
Sorry, Chair, just to clarify, it wasn't really for you. It was more about for us as a council, as a corporate, to have consistency in decision making. So for instance, I'll give you an example. If you've got a house where our policy for age friendly means that we try and keep people in their homes as long as possible, and it means that somebody who raised a family in a property and then became a single person living in that property and had home adaptations to recognise their disabilities, including a wet room, the council then has a decision who that home gets offered to should that person become deceased. And oftentimes we'll have a great big waiting list from people with families and children. And then the council might be saying, oh, actually, we've put so much investment into that property to make it age friendly. We should really be holding on to that property for another older person. But it also means that a 3-bedroom property is not available for a young family who we're supposed to be prioritising through our child friendly commitments. Do you see what I mean? So I think to go behind the stats in this report would be really a good idea about guidance for officers who are having to make decisions like that, which is a little bit like, you know, Solomon and the child, because they are difficult areas where we do have to offer some clarity to the people that we're expecting to carry out our policies.
But for one moment where you're getting to, you were praising us for our council house building programme to make sure choice is maximised in those areas. But as you say, you know, it is down to sometimes the policies we have, and like I say, looking where we recognise where we recognise more needs to be done. It's getting out there and delivering more houses, for example, in the case you've given, and things like that. Are there any more comments on this paper? I'll turn to the recommendations on page 210, and I take it everybody is happy with those. And we're now over to Councillor Cooper's papers, please, in item 15.
Thank you, Leader. And the first of my papers is the financial health monitoring for Q1 this year. I think that the detail in the report is obviously there for exec board members to see, but just to give a couple of points really. At Q1, there is a projected overspend of £1.8 million currently. The budget also assumes £16.5 million worth of directorate saving action plans. And also the report does ask members to note that directorates have been asked to identify action plans to bring the directorate back into a balanced position. I think since this report was published, we've also had the final pay offer from the national employers, and so just to update executive board members on that, that the pay award being offered by the national employers is an increase of £1,925 pounds per NJC pay points at 1 and above, and an additional increase of a day for all employees' annual leave. The finance team are currently working on what that impact may well be on the financial position of the budget in year, and also the cumulative impact on next year's budget and further forward than that. So I intend to bring the work will be done on that, and we'll bring a detailed paper back to September's executive board. But really just to say that it's looking at around a 7% across the board increase in pay, which would have a significant impact on the pressure of the budget going forward. I think we also perhaps need to note more that there are even more inflationary pressures as inflation continues to rise, and also some further work will be done on that to bring back in September. And of course, I must just mention also the impact of the increase in energy costs and how that's impacting on our forecasting ability within the financial papers as well. So we will try and attempt to keep executive board updated throughout all of those challenges and changes within the impact or perceived impact to our budget. I'll leave it there for now, Chair.
Thank you. Alan, any comments on this paper? Councillor Lamb, please.
Yeah, thank you, Chair. A couple of things. There was a promise when the review of charging for non-residential adult social care services was implemented that it would come back to exec board at 6 months and 12 months. So first part of the question is, has it been implemented? And if so, when will we be getting an update here?
Thank you. Kath, would you like to come in, please?
Yes, it has been implemented. So that's with effect from April. So 6 months will be a report probably January time. I've done my maths right.
Thank you, Kath. You had another question, Councillor Lamb.
Yeah, so I'd make that October rather than January if it's from April. So, but anyway, that's
thank you. There's lots of counting on fingers going on here, but I think I very clearly got that understanding that would come back at 6 months as promised, Councillor Lamb.
Okay, so my second question, not related. It's very welcome that business as usual proposals are going to come to scrutiny this year. I'm pleased and thank you for that. It's probably more of a proposal than a comment, and I would suggest, given the scale of the challenge that Councillor Cooper has outlined, that those proposals and savings should be coming here every month going forward, not sort of I think it's too important, and we should be seeing at this board what the impact of those business as usual savings is as we move forward.
Thank you. Councillor Cooper, please.
Yes, we do have a financial update at Executive Board every month, which I try and outline the current pressures on the finances. So it does come to Exec Board every month.
Thank you. Oh, do you want to come back, Councillor Lamb?
Just the specifics of, I know there's an update every month, I'm well aware of that, but specifically, if included in that can be updates on the business as usual savings and what progress we're making, what the impacts are.
Thank you. Councillor Galton, please.
Thanks, Chair. I share the concern of Councillor Cooper about the impact that a significant pay award will have on the council's finances. But as has been pointed out, there's a cost of living crisis and it affects our employees as much as it does our customers. But it does also perhaps escalate the urgency of ensuring that the savings or income production that our departments are hoping to achieve is driven through at pace. And a couple of the issues in the children and family section sort of highlight sometimes how things can be allowed to drift, which can affect future finances. So, for instance, the Little Owls nurseries, the council has been hoping to increase its income in children's services budget plans year on year on year, and never achieved them because the focus wasn't put onto those businesses in our children's centres. And then recently we were assured in September last year that we were going to be having a review of that service so that we can help and enhance the offer so that that income generation could be appreciated sooner rather than later. Now, that was September last year, and I've just asked for a review, given that Little Owls Nurseries is highlighted as a pressure in the report, and we haven't even started that review yet, and it's nearly a year later. How do we increase that urgency, and at what point does Councillor Cooper's department consider help and intervention where it feels that other departments aren't quite offering the urgency of response that is required for the whole corporate budget? And also, there might be an issue. So, for instance, I know that Children's Services have mentioned in here about semi-independent living. There's a pressure on the service because, of course, we've got issues with fostering and being able to put placements there. But the problem with this one is enabling young people out of those placements into permanent placements in housing. And the problem there seems to be the housing department and its ability to provide that accommodation to enable Children's Services to manage their costs in that service. So who has the responsibility for intervening in those circumstances to ensure that departments in the council are responding to each other's needs and not just their own budgetary and contractual issues?
Do you want to ring Julie about that? Julie, would you like to come in, please?
Thank you. Yeah, I'd just like to say that actually there's been an awful lot of work which has been undertaken in relation to Little Owls. since September. So we have had a cross-directorate team with support from other directorates as well as children and families looking at this. I think it's really important, to highlight that actually Little Owls, especially, over the last 2 years, is central to our early help strategy. So there's something there about an investment as well, and thinking about the outcomes for children who do attend Little Owls. A vast majority of those children are children who do have special educational needs and disabilities. But I am pleased to say there's been a lot of detailed, in-depth work done, and there are a number of recommendations which have arisen out of that work, which we will be progressing at pace. In relation to semi-independent living for 16 and 17-year-olds, it's a really complex picture. We've talked about it here, and in other settings, there are issues there in terms of an increased need across the country in relation to adolescents who do have particular complex needs, 16, 17-year-olds. So again, this is not just an issue for Leeds, it's a national issue. There are inflationary costs linked to that, which providers are looking to pass on to the council. Again, there's an awful lot of work going on around that. We are looking to develop frameworks which we'll take to the market. We have put additional capacity in terms of team managers and commissioning colleagues who are going to be scrutinising some of the most high cost placements. So I won't go into it all because there's an awful lot of detailed work that is going on, and I would like to say it is cross-council.
Thank you. Councillor Venner, please.
Yeah, I just want to make a comment that just to say the work isn't being addressed urgently really does not take account of what early years settings have been through over the last couple of years. They've been under absolutely immense pressure just to keep providing services to children and families. And the sector nationally is absolutely on its knees, and that's being articulated regularly by the bodies that represent the early years sector. As Julie said, we are looking at a business model for Little Owls, but also it's worth remembering the origins of our Little Owls settings, which are a lot of them were the original Sure Start children's centres, and by definition, they are situated mainly in the most deprived areas of our city, supporting children. Are you not listening to me now? Supporting children with additional needs and from backgrounds of deprivation. And actually that makes it more challenging to make a profit than if we had more fee-paying parents in a more affluent area. But to say the work isn't being treated as urgent is really, I think, quite disrespectful to how diligently everyone in early help and in early years has been working in extraordinarily challenging circumstances over the last 2 years.
Thank you. Councillor Cooper, please. Then Councillor Galton, please.
Yeah, I'm very surprised by that defensive response from Councillor Venner, because one of the greater achievements that Children's Services has made of late is that it's retained its children's centres, which is a citywide network. I was just turning to check with Councillor Lamb when you thought I wasn't listening to you, to find out if there still is a children's centre in Boston Spa, which isn't one of the poorest parts of the city. And you would have thought would have been just the kind of place that you've just mentioned that would be able to provide some income for the council. And I think the point here is, Councillor Venner, when you're working with colleagues in the council and they've got budget pressures of their own, you need to really be assured that when your department puts down commitments to raise a certain level of income, that you actually have the capacity to do it. And if you think your settings are under such pressure that they won't be able to deliver that, then don't commit to it.
Councillor Venner, please.
Just to be really clear, I didn't say that we weren't able to deliver. I said it was more challenging. And also, as a point of clarity, we have 57 children's centres, but less than 30 are Little Owls settings. Not all our children's centres have Little Owls provision.
Thank you, Councillor Venner, for that useful correction. Councillor Cooper, please.
Thank you. If I can get back to the issue here at hand, and that is around how we work together as an organisation, actually to look at our finances, the pressures on our finances, and how we deal with that. within actually matters. So you asked about who takes precedent over, when does a person step in and when does a person not step in. Well, actually, we work together in a collegiate way across the council, and we recognise that there are pressures in different directorates for different reasons, and those pressures may change throughout the year, or when events or incidents or things come up that we haven't planned for, that we then have to recognise and work together to overcome those pressures and work together around the solutions around those financial pressures too. And I meet with the directors around the finances of each department, as each directorate as well, to go through all of those pressures and all of those efficiency savings. And as I've said, we work together as a one council on this, and as a one administration on how we take that forward. There are, outside external forces that often occur that have to be then dealt with within the organisation, and we're trying to and deal with that in the most compassionate way that we can, especially when we're talking about the vulnerability of children or adults in the city. Thanks, Chair.
Thank you, Councillor Cooper. Does anybody else want to come in on this paper, or shall we turn to the recommendations on page 228? And I take it the board is happy with those. So if we could move on to item 16, please.
Thank you, Chair. And my next item is an update and a quarter one update on the capital programme for 22 to 27. I think that the paper notes that there's a revised capital programme position as a quarter one, and it is of 1.489.9 million. The report seeks some injections into the capital programme that are detailed, that I won't go through, but just to say that all the borrowing required remains within the resources identified in the medium-term financial strategy. I'll leave it there, Chair. Thanks.
Thank you, Councillor Cooper. Are there any comments on this paper? Councillor Lamb, please.
Thank you. It's a question. So I would say a substantial proportion of the capital programme is funded directly from the government. I'd be grateful if officers can confirm to me how much of the rest is from borrowing and what will the impact be on MRP.
Richard, please.
Yeah, if you turn to table 1 on page 260, that details the impact of borrowing in terms of funding the capital programme. So for instance, in 2022-23, the current financial year, current forecast is £560 million of expenditure, of which 234.8 million relates to borrowing, and that obviously can get split down between general fund borrowing and the HRA as well. In terms of the MRP, the impact of that, I haven't got the detail on me in terms of what the spend this year will mean in terms of MRP, but Councillor Lamb, I can provide that for you if so required. Thank you.
Thank you, Richard. And of course, when you say provided by the government, that is, of course, borrowing as well. If somebody else is borrowing it. Councillor Galton, please.
Thanks, Chair. I was going through some of the detail in this, and I noticed on page 268, there was something called City Development Public Realm, which was 839,000. And I looked into it, and the list of schemes associated with it were all Leeds city centre. So I just wondered, is this a pot of money that can be accessed citywide, or is it a dedicated reserve for city centre investment?
Martin, please.
Yeah, thank you, Chair. It'll relate to a series of defined schemes that have either been delivered or in the final processes of being delivering. I don't think that carries forward much further in the programme, Councillor Galton. So if there was any view to deliver public realm schemes over and above that sum, it will be a matter of the capital programme review at each budget review period.
Thank you, Martin. Are there any more comments on this paper? If not, I shall turn to the recommendations on page 259, and I take it that the board is happy with those recommendations. So we're now on to Councillor Venner's papers and item 17, please.
Yeah, thank you, Chair. So this is the annual fostering report covering April 21 to March 22. It's a statutory requirement that we bring the report here, so I bring it every year. We are the largest local authority, the largest fostering service in a local authority. And I've said before that the part of the Ofsted report I was most proud of was the fact that our services for looked after children and care leavers went from good in 2018 to outstanding in 2022. And in the Ofsted report, it singles out our, our foster carers, placement stability, Mockingbird Hub. And this report references that we have a higher percentage of kinship carers than the national average. And that was in the all-party parliamentary group on kinship care. It was the year before last. We were singled out in that report a number of times for our work around kinship, and we have specific teams that just support kinship carers. We're also developing an enhanced offer for SGO carers because obviously that provides increased stability for children. Many of the recommendations that are in the recent McAllister independent review around children's social care reference things that we're already doing in this part of the world in children's services in Leeds, so things like family group conferencing, the Mockingbird hubs, having a lot of kinship carers. I've brought to exec board before our plans to attract more carers, and also specifically one of our Invest to Save proposals being about developing a level 5 foster carer specifically to support adolescents with complex needs, to reduce our need for expensive external placements. So I think it comes across quite clearly in the report that attracting more foster carers remains our greatest challenge and is reflective of the wider challenges in the public sector workforce. And we particularly need to attract more BAME foster carers, and particularly more Black African and Black Caribbean foster carers. The paper references Foster Care Liaison Group, which I have the pleasure of chairing. It's a really wonderful group. It's where foster carers representing all the support groups and the Leeds Foster Care Association meet with myself and senior managers from the department on a regular basis, and we get to hear really directly what their concerns are and work with them very collaboratively on developing the service. And some good news from the last year is that we became ourselves a foster friendly employer, and that's something we can promote with our child friendly Leeds ambassadors to encourage them to do so too. So a very positive report, but there is always more work we can be doing, and particularly around attracting carers. Thank you, Chair.
Thank you, Councillor Venner. Are there any comments on this report? Councillor Lamb, please.
I think my only comment is to thank Councillor Venner and the team for the report, and particularly to thank all of our foster carers and kinship carers particularly, and to encourage anyone, all of the millions who are no doubt are watching the webcast, if they'd never thought about it, it would be a great thing to do.
Thank you, Councillor Lamb. Any more comments? Councillor Galton, please.
Yes, it's a quick one, Chair. It's to do with foster care recruitment, because we have historically had a problem with it, and then the situation improved for a while. And now it seems that people are leaving the service again. And there's some really useful detail in here in terms of what kind of placements they had, or what their reasons for leaving are. But they're not, it's sort of how they've left as opposed to the reason for them leaving. So I'm not sure if people have left to go to other employers, or whether they have gone out of the service because they're getting a little bit older and it's more stressful. Do we have exit interviews with our foster carers to understand that better, because the only response which is in here as a solution is more marketing. And if they're leaving because they feel that there's a better offer somewhere else, for instance, then it will be good for us to know that, so that we could respond a little bit more sophisticatedly than just putting adverts on buses.
Joel's here, who leads the services for looked after children care leavers, will be able to answer that better than I can. I think we do though, Joe.
Yeah, so every foster carer that's that's fostering for Leeds, or indeed any foster carer, has to go through a registration process, and they're approved by following an assessment process at panel and become a registered foster carer. And on exit, it's exactly the same for whatever reason anyone's exiting. So there's an application to a panel that formally deregisters a foster carer, and that's where we get the opportunity to understand the reasons and rationales for why people are leaving. We can say that I can't remember specifically all of those that have left last year, but I remember that at last year's annual fostering report, we were able to report again that none of our foster carers had left to join an independent fostering agency, and some of our applicants to become foster carers had come from independent fostering agencies, which is a benchmark to suggest that word gets round and we're an attractive fostering agency for existing foster carers. So we don't lose foster carers to other fostering agencies.
Thank you, Joel. Julie, would you like to come in, please?
Yeah, I think it's helpful as well that some of the detail which is in the report does highlight that actually 21 of our foster carers actually were deregistered because they moved on to providing special guardianship order placements for children. So again, those children then not becoming looked after, which is a really, really positive story for that group of children. A further 17 foster carers were deregistered because actually the children who they were looking after in kinship placements had actually reached 18. So, I think some of that detail which is in the report, there are some positive reasons for actually people choosing or being in a position where they no longer have to be foster carers. I think the other important thing to say is, despite all the challenges that we have had, of which there have been many, actually the deregistrations, the number of those actually has slowed down over the past year, which I think is no small feat.
Thank you, Julie. I don't see any more comments on this paper, so I'll turn to the recommendations on page 272, and I take it everybody is happy with those. So we'll move on to item 18, please, Councillor Venner.
Yeah, so thank you, Chair. So this is, I'm just looking at which my reports are in which order. This is the MOU paper, isn't it?
This is the care homes
right.
Implementation. Sorry, I gave you a number, not the name there.
Yeah,
it wasn't a test.
Yeah, no, sorry. This is the update on the closure of Homeland House and Richmond House. And I think all I'll say is way of introduction, Chair, and then obviously we can answer any questions, is that just to ask people to note that residents have settled in new homes and there were no compulsory redundancies in this process. Thank you.
Thank you, Councillor Venner. Councillor Galton, please.
Thanks, Chair. Adult social care did follow through everything that they said they were going to do with this particular process. As you know, the closure of Homeland House was resisted locally because we felt that the local choice was important. So it was good to know that quite a lot of people were able to be reallocated to Dolphin Manor. But now there is a little bit of an issue, because Dolphin Manor itself is now going through a refurbishment programme, which begins at the end of summer and will last for 21 weeks. So that's like half a year. And that means that some of the residents that were in Homeland House, I assume, are going to be going through further disruption through that refurbishment. And also there's an issue that they are not, even though they've got vacancies, the home isn't taking on any new placements, and you can't go on a waiting list. So once again, that area around assurance that you'll be able to go somewhere that you're aware of, you have confidence in, and is a local setting near to residents. There's a little bit of an issue there, isn't there? And if there were two homes open at the same time, perhaps there could have been some, what's the word? Movement between them, but still being in the same area. So there's a little bit of a regret there, perhaps, that refurbishment couldn't have taken place before Homely House had closed, so that there could have been some transference in a local setting. Can you offer some reassurance around how quickly the Dolphin Manor refurbishment can happen, so that local families can once again have the option of a local council-owned accommodation?
Thank you. And of course, like you, Councillor Gotton, we all welcome the investment into Dolphin House and protecting its long-term future. Really significant work. Kath, would you like to come in, please?
As long as they don't find anything unexpected, which I don't expect them to do because they survey very well before they commence work, it should be completed within the time scale. It's a challenge in terms of managing this, but I think the environment does need an uplift, and it's some short-term disruption for a long-term gain. We certainly would be very pleased to see more people come to Dolphin Manor once we finish the refurb.
Thank you, Kath. Are there any more comments on this paper, please? Councillor Lamb, please.
Yeah, it's specific to the Farsley site and what happens next. The view of the local members is that it can and should be retained for ideally extra care housing, but certainly older people's housing. And it's been suggested to them that the site's too small to accommodate that. However, the point they would make, and my urging would be that good work's done with the ward members on this, is it's right next door to an existing extra care facility with all of the facilities on site. And if it's considered an extension of that, it absolutely is big enough to accommodate that type of housing, which is much needed in that location. So it's to make that point and to urge urgent conversations with ward members in Calverley and Farsley to try and make sure the best use of that site is made.
Thank you. This is a report into the a report, as we said, into the implementation decision around the care homes, but I'm sure Martin or Kath can pick up the side.
Sorry, Chair, I'm referring specifically to recommendations.
Oh yeah, no, I appreciate that, but it's not. This isn't a paper to decide the future of the site. But you've made a no. I'm not saying it's not a fair comment. So I'm asking an officer to come in to answer it, Alan. Thank you for helping me chair the meeting. Martin, please.
Yeah, thank you, Chair. I mean, in terms of the points that Councillor Lamb makes with regard to the size of the site and its suitability, the information he's got is the same as the information that I've received. In terms of the comment you make about the potential for economies of scale with an adjacent facility, I'm very happy to look at that personally and come back to you with a view as to whether I think that changes the matter or not, if that helps.
Great, thank you. Are there any more comments on this paper, please? I don't see any comments. So we turn to the recommendation, noting the ongoing work on the future of the sites, and I take it everybody on the board is happy with those recommendations, and we'll move on to item 19, please, Councillor Venner.
Yeah, thank you. This is the Memorandum of Understanding paper, which is about how we all work together across the health and social care sector following the passing of the Health and Social Care Act, which brought into being the integrated care system and the integrated care board at a regional level, and then the Leeds committee of the ICB. So this is about how we work together. There was a separate report that went through General Purposes Committee, which approved the changes that are required to our constitution, but largely they were just removing references to the clinical commissioning group and replacing them with the Leeds Committee of the West Yorkshire Integrated Care Board. So that's what the purpose of this paper is. I've been alerted to the fact, I didn't spot this myself, but it's very tiny, There's apparently an error on this paper which needs to be corrected in the minutes, and it's the fact that on page 300 at point 14, paragraph 14, there's a diagram which shows the structure before the 1st of July and after. And in both diagrams, there's a teeny tiny word scrutiny, which is at the side of both documents, side of both diagrams. And governance have picked up that there's not a reference to scrutiny in the text. So that's the change that they are stating needs to be made, that scrutiny is referred to in the body of the text to reflect the fact it's in the diagram. But once I was alerted to the mistake, it actually took me ages to find it, because it is, as you'll see in the diagram, it's a very tiny word, scrutiny. So I believe I've never had to do this before, correct paper at this stage at exec board, but I believe that it gets recorded in the minutes that that change will be made. Thank you.
Thank you, Councillor Venner. Yes, when we come to the recommendations, we'll pick that one up. Are there any comments on this paper, please? Councillor Lamb, please.
Well, I've got one less comment to make now, because I was going to make that very point, so I'm glad you picked that up already. Reading it through, the feeling I have with it is there's an awful lot of bureaucracy here. Could we not streamline some of this? And how is all of these boards and meetings and committees, how is it helping people to be healthier in Leeds, which is the purpose? And I just wonder if we're making it more complicated than we need to.
Thank you. I don't know how many, I don't know, maybe when the government reorganises the NHS again in about 18 months, they'll pick your comments up. Kath, would you like to come in on this one, please?
It's not entirely in our gift, because some of these are the requirements of how the NHS sees itself as taking and delivering the NHS plan. So things like the population health boards are a new development, and the way the government sees the NHS going forward is to take a population health approach, which is why we have to start planning some of our governance behind that. That will be data driven, and it will have finance decisions flowing out of what some of that data tells us. So we do need a new landscape. I do accept it looks complicated. Actually, it is a complex system, and we try and make it as simple as possible. I'm sure we will all take that challenge away, and as we go live in the new system, there will be a review about, is this fit for purpose? Does it work? Are there things we need to change?
Thank you, Kath. Councillor Venner, please.
I was going to make a similar response, actually, which was to say, yeah, it is quite bureaucratic, because, to be honest, much as we all love it, the NHS is quite bureaucratic, and I think it's been one of the most challenging aspects of taking on the adults role is getting my head around the way the NHS works and all the structures within it. However, I would agree with Kath that I think the population health boards are a really good opportunity that do bring people together. So there's a children's population health board that Julie will sit on, for example, or already sits on. So there are some new structures that are bringing people together in a way that they weren't as much before. Also, we will retain our health and wellbeing board, which I chair at the moment, and that keeps the kind of democratic accountability within the system. And all the key players in the new structure, who are many of the same people who've been around in the pre-structure, will continue to sit on that. As you probably know as well, Rebecca Charlwood is the chair of the Leeds committee at the West Yorkshire Integrated Care Board, which I think is a great appointment and really positive for us in terms of having someone who has a good understanding of local government in that position. So I'm really sorry this is a bit of a bureaucratic paper. Yeah, I think we try really hard to make this stuff as comprehensible as possible, and we get challenged on that regularly by Health Watch and by our third sector partners. And yeah, we'll continue to work positively with our partners across health and care going forward in this new world. Thank you.
Thank you. Tom, would you like to come in, please?
Yeah, it's on the same theme, really. I think we've been, over the last few years, the driving with partners in the city attempts to do just what you've said, to try and get a more whole system approach and get us working together much more effectively in what you might call a team leads way of working. But a lot of the time, because of the way that the money comes down from the centre nationally, it makes it very difficult to do that, and the way the statutory responsibilities and the executive responsibilities fall, it does lead to this complexity. I think one of the big opportunities of this change is that what population health basically means, the whole system, the whole population of Leeds is the starting point for a lot of the joint work now in a more formalised way that wasn't the case previously, and that is what we've been seeking over the years much more, because that's the way we commission and that's the way we work. But I think the addition of the West Yorkshire level to the Leeds level as well brings with it risk as well in terms of complexity, and we've got to make sure that is definitely a bit like the devolution agenda that we've debated before in this board and others on the economic side. We've got to make sure that brings power and resources down from the centre, from Whitehall and NHS England, and gives more capability and influence for you as elected members at that level, at that West Yorkshire level, rather than move powers and influence and resources up to that West Yorkshire level from the local. At the moment, I think it's very much the former, so it is going in the right direction, but that's why diagrams like this are quite important, and why I think we need common cause in making sure that the Leeds element of this is very strong, because Leeds is, with the latest population statistics, probably getting closer to 40% of West Yorkshire, and we've got to make sure that we play that role that doesn't over dominate that agenda, but plays the rightful role that we've got. But no, I absolutely agree that it is complex, but the issues we're trying to solve are quite complex as well, I guess.
Thank you, Tom. Are there any more comments on this paper? So I will turn to recommendations on page 297, and let's see that the board are happy with those recommendations. So we'll move on to the late item under Councillor Venner's portfolio, please. If you'd like to introduce that, please.
Yeah, thank you, Chair, for allowing this late item, which is entitled Children and Families Social Care Workforce in Leeds. And this is the report that I committed to bring to Exec Board at full council last week. And I'd really like to thank Farah, who's just appeared at the top table, and Julie and your team for pulling all this information together so quickly. So this report outlines the chronic pressure children's services are under. It references the collective grievance, and it outlines the steps we are taking to resolve the issues. This includes addressing issues relating to terms and conditions and an extensive recruitment and retention strategy. Recruiting more social workers is essential to bring caseloads down. We need to all be championing our outstanding children's services, advocating for them, and speaking positively about Leeds City Council as an employer in order to attract people to work with us here in Leeds. The report situates Leeds in the local, regional and national context of a crisis in social care recruitment. It also highlights that Leeds actually has a lower turnover rate than other authorities, including other outstanding authorities. And of course, it highlights the chronic need for more funding for children's social care and the impact of poverty in driving increased demand for services. The report lists caseload numbers, and importantly, it details the way in which children and families are safeguarded in this challenging context. The Ofsted report praised me for my impressive level of operational detail. How I get this detailed knowledge is by spending as much time as I possibly can with children, families, and our frontline staff, as well as definitely being the most delightful part of my role, it also does give me the knowledge which enables me to be an advocate for the Directorate. Just on Sunday, I was in the rain at a huge event organised by Leeds Foster Care Association, where I was spending the afternoon with children and families who are foster families. And Sal, Julie and I regularly meet frontline social workers, and I get to hear directly how stressful and challenging life is on the front line of children's social work at the moment, and how hard staff are working to keep children safe and continue to deliver compassionate, effective support to families. The report highlights some Ofsted comments from their examination of 500 cases over a thorough 3-week inspection. Ofsted were assured that children were not only safeguarded in Leeds, but were receiving exemplary support, and consequently, they gave us our outstanding judgment. However, we are never complacent, and we continue to implement our improvement plan from this inspection and from the focus visit last July. The report highlights some of the national work that we are asked to do. This includes work with the Department for Education through strengthening families supporting children. And I sit on the National Local Government Association Board for Children and Young People. And Tom, our Chief Executive, has been asked to be one of the very few people sitting on the national board, which is implementing the Independent Review for Children's Social Care. And this shows how highly regarded Leeds Children's Social Care is nationally, including by the government, who have asked Tom to undertake this work. And Leeds is very much being asked to take on a key role in the national development of children's services through our national work. I'd like to conclude by asking all Exec Board members to support and champion Leeds Children's Services in the challenges that we face, to enable us to continue delivering outstanding services to the children of this city. Thank you, Chair.
Thank you, Councillor Venner. Are there any comments, questions on this paper? Councillor Lamb, please.
Yeah, thank you, Chair. There's a few things to say. I'll cover at the start. I feel in a slightly uncomfortable position as scrutiny chair, and also sitting here in a political role today. I wasn't aware this paper was going to be coming when I was proposed to do this board, but I'm here, so it's my job to respond, and I'm going to do my best to wear both hats at the same time. So I hope you'll keep that in mind. The second point is, obviously, we got sight of this very late in the day. We haven't had the opportunity to be briefed on it. So there's a number of questions that normally we'd ask in a briefing in advance, but we haven't had that opportunity. I'm in the privileged position as scrutiny chair of being relatively familiar with the issues. I'm not sure the same courtesy has been extended to Councillor Galton. So if you don't, I'm going to ask a few questions, probably to officers first, and then I have some general comments that I'd like to make. So I've got 5 questions which I'll put out, and probably for Julie or Councillor Venner between them. So given the acknowledgement of caseloads above the target number in the paper, are managers now pushing staff to close cases at the moment to try and address the statistics? Of the vacancies reported, how many are in the frontline area child protection teams? Do the average caseload figures include teams who should ordinarily have low numbers, like those supporting children with disabilities? Complex families often require 2 co-workers to attend and deal with cases. How is this taken into consideration on the case numbers? And finally, the report lists the actions the council have taken in response to the grievance since April. Can you confirm that since April, the number in the grievance has increased from 77, and how many are in the grievance today?
Thank you. Julie, would you like to start, and then maybe Councillor Venner can pick up any questions after that? So Julie, please.
Yeah, of course. I think with respect to the question about closures, our raison d'etre is to ensure that we are giving children and families across the city the help and the protection that they need. So we will never, ever close a case where we feel that that family or that child is in a position where they need ongoing help or protection. So I want to be very, very clear about that. In terms of the vacancies, the vacancies are across our area social work teams, and that's really all of our teams that offer protection to children, some of our children looked after teams, and our child health and disability team. So we do have vacancies across the system. In terms of co-working, absolutely. We do continue to have that approach to the delivery of our services. And that's about ensuring that staff have support, but it's also about ensuring that ongoing, development in terms of less experienced members of staff gaining that knowledge and experience by co-working with others, observing best practice, in real time. In terms of the numbers in the grievance, Councillor Lamb is quite right. That was originally 77, and we have had some recent communication where there's a small number of other social workers who would like to be added to that. So I think it's currently at around 80, just over 80. I suppose what I would just like to reiterate is that our social workers in Leeds do an absolutely fantastic job. We could not ask any more of them. It is a really challenging national context, as has been set out in the paper and by Councillor Venner. And it's our role, as leaders, as managers within the service, to ensure that those staff are giving detailed managerial oversight and support. So in terms of supervision, in terms of Farah's role as principal social worker, in terms of our advanced practitioners, of which we have recruited an additional number of advanced practitioners, that we are responding to the pressures that we know that our staff are under, and that we will continue to do so.
Thank you. Councillor Venner, please.
I think the only points I'd want to add, obviously we're taking the concerns of our staff extremely seriously, and the fact that we brought this paper as a late item following full council demonstrates that. I really appreciate that people haven't had a lot of time to see the paper. However, the fact that we brought it as a late paper reflects how seriously we're taking the issues, and the fact that we wanted to respond to concerns raised not only by our staff but by opposition councillors, and we wanted to provide assurance at a public meeting, which is why this paper sets out what the challenges are and what we're doing about them. In terms of the grievance numbers, I'm not saying this in any way to minimise the grievance or to minimise the concerns people have. We have 500 social workers across our services if you include adoption. So the number that have raised a grievance accounts to about 16% of our workforce, which is obviously hugely significant, but isn't the majority of our staff. Nevertheless, I've outlined in detail the huge challenges that we are facing and what we're doing to address those, and the ways in which we are supporting our staff in this very challenging context.
Thank you. Tom, do you want to come in?
Yeah, I just wanted really to support what Julie and Councillor Venner have said, and just to reiterate how much we appreciate the work that our social workers do in the city, and how critical it is to the success of the city and the organisation, and how much pressure they're under and have been under coming out of COVID. The situation, I think, is one where we really recognise and are listening to what the feedback that we're getting, and that's this, the processes we have in place and the union relationships we have in place are here for the very reason that, that this is a dialogue that we're having, that we're actively working through, where legitimate concerns have been raised, and some of them we are looking to respond to more immediately. Others are more long-term issues that we'll be working with, our social work colleagues and our union colleagues over, I think, a long period of time, as far as I can see, because of the the pandemic and because of the situation that, as the report sets out, is in place, nationally and regionally. And so, I just wanted to give that commitment that we will continue to listen, we will continue to work through these issues, and we'll continue to recognise the massive difference and in really, really challenging circumstances that our social workers, our early years staff, the whole range of staff that sit behind this, this set of issues within children's services and actually outside and within the partnership more generally, we will continue to work through them, and we're committed to trying to continue that dialogue and addressing, as many of the concerns as we can moving forward. But I see this as something which is a sign of an organisation that is open, that is there to be challenged at times, rightly, but one where we'll continue to try and work through them and do what's best for children in the city, which is what everyone wants.
Tom, Councillor Lamb, please.
Yeah, thank you, Chair, and thank you for those responses. This is more comment than question at this stage, and I truly hope it will be taken in the spirit that it's meant. I don't doubt for a second that every single person around this table, every elected member, every officer is totally committed to keeping children safe. I think we're all incredibly grateful for what our social workers do, and I don't think there's any thanks or praise we can give them highly enough. Some of my colleagues were criticised for raising this last week. I think the paper and the response shows that they were right to do so. And one of the wider points I want to make is actually about being open. And Tom just said it shows we're open, but there have been a number of instances recently. This is one where actually we haven't been open. This grievance was received in April. The first I knew of it as scrutiny chair was well into July. And as far as I'm aware, not even all opposition leaders and groups have been briefed on the situation as yet. We had the same situation with the notifications issue. And I think members raised it last week because they felt that was the only way they could get it onto an agenda and see something be done, or at least know something was being done, because they weren't being communicated with. And it's a sad thing to have to say, but however well-intentioned people are, when good people with good intentions aren't open and don't share, it does potentially, and history has shown us, leave a space for bad people to do bad things to children. And we can't allow that. And historically in this council, there has been an open culture where when there's a difficult situation, all groups and all parties are briefed immediately. I've had assurances, which I accept and welcome, from Councillor Venner, that that's going to change going forward. And I really hope it does, because it's too important. These are too big an issue to make sure we support the welfare of our staff, give them the support they need, and make sure that they can help to keep our children as safe as they possibly can. Thank you.
Thank you, Councillor. I welcome the comments in the spirit they made. I mean, clearly, we wanted to bring this report as quickly as possible, and I accept that there's an element of that that means it came out yesterday. Tea time. However, I thought it was important with some of the comments in council last week, and I hope that no one feels that they were criticised for raising important issues in council last week, because, like I say, as Councillor Venner said, we committed to bring the report last week in full council, and we brought the report this week forward with the information in. And again, you're absolutely right. I would echo what you've said and what Tom said about the importance of recognising the need for openness on this, and that's why I was keen to get it on this agenda as quickly as possible. We could have a debate elsewhere around how items come onto the council agenda. I think that's a separate debate, but recognising this report came forward for this agenda is part of that process of openness. And I'll thank you for your comments. Does anybody else? Councillor Gordon, do you want to come in on this paper, please?
Yes, thanks, Chair. It was to find a positive out of all of this. it was with dismay that I've just very recently read some of the things in this paper are talking about caseload levels, because there is reference to it in this paper around when the council was in an inadequate position when I was in charge of children's services. And one of the areas of concern was the level of caseload and the support that was being able to be offered to those stressed social workers. I see the mention of advanced practitioners again, which was one of the first things that we did as an authority to improve the situation. So that's good to hear. So I have confidence completely that the service is on top of this. But I would also like some reassurance around how we go forward, because all of the information here is based on national surveys, and then there's lots of comparatives with other local authorities, and we're not quite as badly off as some other people are. But generally, the message here is of a downhill trajectory in terms of sustainability of social care workforces. And from my conclusions of reading all this, it seems like there needs to be a lot more cross-working across local authorities, because you just pointed out you've got outstanding and you're facing problems. There are other authorities that are inadequate, and they're going to be facing twice the amount of problems, aren't they? And what's most important is that we all share responsibility for the well-being of the kids across West Yorkshire, for instance. And if more people are going into agency work because they feel that that is less stressful for them, and also it is more attractive for their income levels, then we need to respond to that jointly, perhaps across a regional or a sub-regional footprint, to ensure that we can offer the assurance which is needed for more permanent employment within local authorities. And that when people leave the profession, they're not leaving social work, in totality. They can actually move on to a different authority, or if they're going into agency, that they're still working within the profession, or that they're going into another area where their social work qualification is still adding social benefit through the work that they do. So I would like to see more detail on that coming forward, in terms of that feeling of common purpose, not just in Leeds, but across West Yorkshire, to say, yes, not everything isn't always rosier in Leeds. But actually we're in a good position to help others in a leadership capacity.
Thank you. I'm sure I can see Julie, maybe Farah want to come in. I'm sure obviously, the strengthening families work we do, where we get a significant amount of money from the national government to do just that, Stuart, what you've talked about in terms of leading capacity across the sector, not just ourselves, reflects that. So Julie or Farah, would you like to come in, please?
Yeah, I'll come in. I suppose just to say that absolutely, we have our own particular challenges in Leeds that we're really clear about. We're well aware of them, and we are working collaboratively across council and also with our staff, listening to our staff to do our best to respond to those. But Councillor Galton, you're absolutely right. There is a need for these pressures to be discussed regionally, and they are. So the directors of children's services across West Yorkshire, across Yorkshire and Humberside meet regularly. These are features, as you'd expect, of those live discussions. Farah's principal social worker meets nationally with principal social workers. I meet nationally with a group of leaders, directors, deputy directors across the country. So I think the other thing to say is that the recent National Care Review set out by Josh McAllister, again, identifies a number of the pressures that we're talking about today and sets out some recommendations for them. We've met, a number of us around this table have met with Josh McAllister, and we will continue, as it's been referenced in terms of Tom's role in the National Review, to shape and influence the picture at a national level, a regional level and a local level.
Thank you, Julie. Does anybody else want to come in on this paper? Tom, please.
Yeah, just to pick up the national issue, I do think we've got to recognise, and I was in it was an interim meeting of the new board recently with the minister and with Josh McAllister and, you know, very senior members of Ofsted and the Department for Education. The reality is that we need, given that children's social work sits in, you know, in local government, the real key to be able to remunerate and have career progression and have the right systems in place is a long-term sustainable financial settlement for local government. And without that, we will all struggle massively to deal with the extra demands that are in the system, 30% up from the pandemic going forwards. And there's also an inextricable link with the NHS in all of the work that we do. And the NHS has rightly had resources to tackle the backlog, to have the pay award that has recently been announced, that's funded. We need full funding of local government, as has been heard before, in terms of pay awards, because if we don't have that, then we will have to, take really serious decisions that are going to affect the sort of work that we're talking about and the preventative work that actually is crucial, as the McAllister Review says, and as Farah and her teams and Julie have said. That's the way to make the real difference, to take the caseloads down and take the pressure off. If we can get that downstream work done, that upstream work done, in a really effective way. So I think there are some really big national issues here that we need. It's really about parity of esteem for social care with the NHS. That for me is the basis of this, and as significant a training programme and a career progression programme for social workers as there are for doctors and nurses. And that's where we need common cause with government and common cause across party politics to get to a point where we can really get what's needed for the people that we're talking about who are under pressure every day in the city.
Thank you. Councillor Venner, please.
Do you want me to sum up, or I'll?
Yes, please.
Okay. Does anyone? Okay. So I'll pick up a few of the points that have been covered. Firstly, Councillor Galton, you referred to the fact that Leeds is outstanding, and if we're facing these challenges, other authorities maybe will be facing them in an even more pronounced way. And actually, that is the focus of one of the points being made by Unison, who are representing our staff, that in terms of their national campaign around social care, they are saying yes, when even an outstanding authority like Leeds is carrying vacancies, that is symptomatic of a national crisis. And it's also true, the point you highlighted that I referred to at council last week, that of the staff that left social work last year, 23% went to work for agencies, and that is not what we would want to be happening. Apart from the fact we want staff working in our authority, you're not getting the same, peer support and team working that you would get, particularly as a younger social worker working in an authority. And your point was well made as well about liaison across West Yorkshire. It's really important that local authorities work together so that we're not outbidding each other for staff. And I know that's, those are conversations that I've had both with Kath and Julie in relation to adult and social care. I would want to, I know this has been said many times, but I would absolutely just really want to stress appreciation of our staff who faced the most extraordinary challenges over the past 2 years and continue to provide, outstanding, compassionate and effective services to our children and families. I think when I visit our social workers, both in adults and children's, the thing that's always just really striking is their absolute love and passion for their work, and also their just huge amount of skill. We really do know how challenging the context is that we're working and how stressful life is at the moment for frontline staff. In terms of caseloads being higher than we would want, our average is just over 20 against, a regional benchmark of just over 18. And so referring to the point you made, Councillor Galton, about what high caseloads can lead to. That's why we were really clear in the paper that we wanted detailed description of how we're keeping children safe in the challenging context that we're working in. And also we have got some positive news in that we have got, you know, new starters who've started with us between April and up to September. We've got new social workers, new advanced practitioners and social work assistants. With regard to the challenge around openness, I've said this a few times, but it really is the case. We would not have got the outstanding judgment from Ofsted if we weren't open and self-reflective. I only met the inspectors once because they really didn't want to spend their time, you know, with politicians and senior managers. They were out on the front line. I met them once and the first question they asked me was, what do you think we'll find? And I said, you won't find anything we don't know about. And then I went on to describe what I thought they would find. But we were really open about the caseload challenges, about the context we're in. And they did feedback about our level of reflectiveness. The point I was making at full council last week, where Councillor Lamb said people felt criticised, what I was trying to convey was the risk inherent in what felt like any attempt to kind of devalue our Ofsted rating or our work, because actually the way this is going to be resolved is by having more people come to work for us so that we do have the caseloads where we would want them and staff have the structure around them that we would want. So it really, really is important that we all champion our services and disseminate our outstanding social work practice and promote Leeds and Leeds Children's Services as a positive place to work. And I will conclude with the point Tom made, that absolutely underlying all of this is just the absolute urgent need for more funding for children's social care. It was the biggest issue highlighted in the British Association of Social Worker annual survey. You know, so more than 67% of social workers said their biggest challenge now and in the immediate future was inadequate funding for children's social care. And within that, it does make it a challenge, but even more important that we do continue with the prioritisation we've had, you know, over the last 10 years of prioritising early help and early intervention as the best way of supporting children and families. Thank you, Chair.
Thank you. And I'll move to the recommendation, which is on page 3 of the extra report we received today. And I see that everybody is happy with that recommendation. Great, and thank you. And at that point, I will close the meeting and I hope everybody has some time off to enjoy the weather over the summer. We don't have any items below the line, so that's the end of the meeting.